All right, if you're a hospital leader in rural Maryland, I need your full attention. The next few minutes could seriously define the next decade for your entire institution. We're about to break down a program that is a complete game changer, one that's about to pump a massive amount of capital into the system. So, let's get right into it.
First things first, just look at that number. For fiscal year 2026, Maryland has been awarded over $168 million. Now, let me be really clear about this. This isn't just another grant to plug some hole in your budget. No, this is a historic infusion of capital, and it's designed for one specific purpose: transformation.
So naturally, that brings us to the big question on your mind, right? As an administrator, with this much money on the table, how in the world do you position your hospital to get a real meaningful slice of that pie? Well, that's exactly what we're going to walk through, step by step.
You know, what's so interesting here is the strategic choice this all presents. Think about it like this. Your hospital is standing at a fork in the road, a real bifurcation point. You can keep going down the same old path, just trying to survive, or you can use this funding to pivot, to innovate, and to build a totally new, much more sustainable future. This money, it's the catalyst that lets you make that choice.
Okay, but before you can win this money, you've got to understand the ground that's shifting right under your feet. It's absolutely crucial to grasp the massive regulatory change that's happening in Maryland as the state moves from the old TOCOCO model to the new AHAD model. This funding, well, it's the master key to unlocking success in that brand new world. So let's break that down, shall we? On the left, that's the TCOC model. We're all used to it. It was mostly focused on capping hospital revenue, keeping costs inside the hospital walls in check. But on the right, you've got the new AHED model, which is so much broader. We're talking expanded accountability beyond the hospital, demanding deep primary care integration, and this is a big one, hitting very explicit health equity targets. Your grant proposals have to, must, speak the language of AHED.
The AHED model immediately creates a pretty big challenge, right? How do you pay for all the new stuff, the infrastructure, the tech, that you need to manage population health? Well, that's where this idea of the capital gap comes in. Your global budget pays for operations, keeping the lights on. It doesn't pay for building a new fleet of mobile clinics. The Rural Health Transformation Program, the RHTP, is designed specifically to fill that exact gap with what's basically free capital.
And this, right here, is probably the single most important financial point you need to understand. The state's Rate-Setting Commission, the HSCRC, has confirmed that these RHTP funds are additive. That means they will not count as revenue against your global budget. This is huge. It means you can invest in new capacity, build out new programs, and you don't have to fear that the state is just going to claw all those gains back through a rate adjustment later on. It's a total game changer.
Okay, so you get the new landscape. Now let's talk about the money itself and how you get it. Maryland has very smartly structured all $168 million around three distinct strategic pillars. Your job is to align your proposal squarely within one of these pillars. Honestly, that's the first rule for writing a winning application.
Pillar number one is all about people, and the goal here is to move way beyond just offering signing bonuses to get people in the door. It's about fundamentally re-engineering the entire pipeline of talent. It's about building a sustainable, local healthcare workforce that actually wants to stay and grow right there in your community. So what does that look like in practice? Well, this pillar funds really specific, high-impact projects. You've got to think bigger than just recruitment. You could get money to fund new clinical apprenticeship programs, or maybe build some housing to support rural rotations for medical students, or even embed peer recovery specialists in your ER through the already established RAMP program. These are the kinds of concrete, fundable projects the state is really looking for.
So with all those great options on the table, what's the secret sauce? How do you make your workforce proposal the one that really stands out from the pile?
The answer, in a word, partnerships. It's absolutely crucial. The reviewers are going to heavily favor applications that show you're not trying to do this alone. A signed agreement with your local community college or the Department of Labor, that shows a true ecosystem approach. And hey, if your proposal includes return of service agreements where you fund someone's education in exchange for commitment to work for you, that proves you're serious about long-term sustainability.
Okay, let's move on to Pillar 2. This one's all about the how and the where of healthcare delivery. It's designed to fund the big structural changes you need to provide care more efficiently and, frankly, more effectively in spread-out rural areas. This is where your really innovative ideas about your delivery model can get funded.
So the opportunities here are really focused on modernization. For instance, you can get capital to right-size a service line, say converting a bunch of underused inpatient beds into a badly needed behavioral health unit. Or you could get funding to buy a whole fleet of mobile integrated health vans to bring care directly to your patients. Or hey, maybe you can finally make those critical and expensive investments in telehealth and cybersecurity.
Ah, but that term right-sizing, that can be politically toxic, can it? Nobody in the community wants to hear about closing a service, even if it's being totally underutilized. So how do you even frame an application for this without creating a huge community firestorm?
Here's the key strategic advice. It is all about the messaging. You have to frame your application around modernization and expansion. Don't talk about what you're closing. Talk about what you are opening. Focus everything on the net gain for the community. So for example, you're not closing an OB unit. You're opening a new regional center for behavioral health. See the difference?
Now let's talk about the third and I think most innovative pillar. This is really unique to Maryland's plan, and it leverages one of the state's greatest assets, agriculture. This whole pillar is about formally integrating the healthcare system and the local food system to attack the root causes of chronic disease. The whole concept is food is health, and you can apply for capital to build things like food aggregation hubs with cold storage, connecting local farms directly to your hospital cafeteria. You could launch medically tailored meal programs for patients after they're discharged. Or you could even fund produce prescription initiatives where your doctors can literally prescribe fresh, healthy food for their patients. It's incredible.
Now, I know what you might be thinking. This feels a little outside of a hospital's traditional lane, right? So the very practical question is, how do you actually do this? How does a hospital get into the food business?
Well, the strategy is pretty simple. You act as an anchor institution. Think about it. Your hospital is probably one of the biggest food purchasers in the entire county. You can use these grant funds to completely overhaul your own food procurement systems, to buy directly from local farms. And a partnership with the Maryland Department of Agriculture, well, that's not just a good idea for this pillar, it's practically a requirement.
Okay, you've got the strategy. You know the pillars. Now, let's get tactical. This final section is your clear, step-by-step guide to get you from this moment, right now, to a successful submission.
Here it is. This is your critical path for the first half of 2026. January and February, that's all for strategy and partner meetings. Get your internal team together and start meeting with those community colleges and your local health department now. Then by March and April, you need to be watching for the RFP to be released, and you should already be drafting your proposals. This timeline makes what seems like a complex process feel really concrete and, more importantly, totally achievable.
And finally, this right here, this is your cheat sheet. This is how your application is going to be scored. And look closely. Sustainability is the biggest piece of the puzzle at 25%. They really wanted to know how this program is going to survive after the grant money is gone. And look, community voice and impact are also huge. You need to tailor your narrative to hit these points hard to maximize your score.
So, let's end with what is maybe the most important takeaway of all. It's a shift in your mindset. Don't look at this as just another grant application you have to grind through. This is your chance to draft the actual business plan for your hospital's next decade, a plan that will finally actually be funded. And the time to start drafting that plan, well, it's right now.